Today I will be discussing the anticoagulant warfarin. Warfarin is classified as a vitamin K antagonist and is one of the most widely used oral anticoagulants. It is commonly known by the brand name Coumadin. The primary purpose of warfarin is to prevent the formation and extension of blood clots. Unlike medications that dissolve clots, warfarin works by preventing new clots from forming and existing clots from getting larger. It is typically prescribed for long-term anticoagulation therapy and requires careful monitoring to ensure patient safety. To understand how warfarin works, we need to briefly review clotting factor production. Warfarin works in the liver by inhibiting an enzyme called vitamin K epoxide reductase, also known as VKO-RC1. This enzyme is necessary to activate vitamin K. Active vitamin K is required to produce several clotting factors, specifically factor 2, which is prothrombin, factor 7, factor 9, and factor 10. These are sometimes remembered as 2, 7, 9, and 10. By blocking vitamin K activation, warfarin reduces the liver's ability to produce the clotting factors. As a result, the blood takes longer to clot. It also decreases protein C and protein S, which are natural anticoagulants, which is why patients may initially require bridging therapy with heparin. Because warfarin affects clotting factor synthesis rather than circulating clotting factors already in the bloodstream, it has a delayed onset of action. It typically takes about 3 to 5 days to reach therapeutic effect. Warfarin is prescribed for several major conditions. One of the most common indications is atrial fibrillation, where it helps prevent stroke caused by clot formation in the heart. It is also used to treat and prevent deep vein thrombosis, also known as DVT, and pulmonary embolism, which is a clot in the lungs. Additionally, it is the anticoagulant of choice for patients with mechanical heart valves, because many newer anticoagulants are not approved for this population. Warfarin may also be used in patients with certain inherited clotting disorders to prevent recurrent thromboembolic events. The most common and most serious adverse effect of warfarin is bleeding. Because warfarin reduces clotting factor production, patients are at increased risk for bleeding complications. This can include easy bruising, nosebleeds, bleeding gums, blood in urine or stool, and in severe cases, internal hemorrhage. Warfarin carries a black box warning for a major or fatal bleeding. Another possible side effect is gastrointestinal upset, including nausea or abdominal discomfort. Warfarin is contraindicated in pregnancy because it can cross the placenta and cause fetal harm. It is also contraindicated in patients with active bleeding or severe liver disease. One major drug interaction occurs with antibiotics. Antibiotics can decrease the normal gut bacteria that produce vitamin K. This can increase INR levels and significantly raise the risk of bleeding. Therefore, patients starting antibiotics while on warfarin would require closer INR monitoring. Warfarin requires regular laboratory monitoring to ensure safe and effective dosing. The primary lab test used is the prothrombin time, also known as PT, which is standardized as the International Normalized Ratio, or INR. For most patients, the therapeutic INR range is between 2.0 and 3.0. For patients with mechanical heart valves, the target range is typically higher, around 2.5 to 3.5. If the INR is too low, the patient is at risk for clot formation. If it is too high, the patient is at risk for bleeding. In addition to lab values, nurses must monitor for clinical signs of bleeding, assess medication changes, and evaluate dietary habits. Patient education is critical when managing warfarin therapy. First, patients must maintain a consistent intake of vitamin K-rich foods, such as spinach, kale, and broccoli. Sudden increases or decreases in vitamin K intake can alter INR levels. Second, patients should report any signs of bleeding immediately. This includes black or tarry stools, blood in the urine, severe headaches, excessive bruising, or prolonged bleeding from cuts. Third, patients should avoid NSAIDs such as ibuprofen and aspirin unless prescribed because these medications increase bleeding risk. Additional education includes taking warfarin at the same time every day, attending regular INR monitoring appointments, using a soft toothbrush and electric razor, and informing all healthcare providers that they are taking an anticoagulant. Proper education and monitoring significantly reduce the risk of complications and improve patient safety.